Preparing for flu season and doing so now. Fox 59's Michael Henrik is live with what you need to know about the variety of vaccines and also which ones are best suited for you. Michael?
Hey, good morning, guys. Yeah, I don't want you to take my word for it. That's why we brought a physician in here. We're at Community MedCheck in Noblesville with Dr. Michelle McCarthy. First and foremost, thank you for getting up early and coming in here this morning. So tell me, what are you holding in your hand and why is that particularly new this year?
Thank you. Well, this is exciting because this is the first year that the quadrivalent flu vaccine is available in the U.S. market. And previously we had protection against 3 strains of the flu, but now we have protection against 4 strains of the flu. We have it in the form of a shot and a nasal mist for our community.
Now, is that the only version available now, the one with 4 strains, or is the 3-strain version still around?
The 3-strain version is still around. It's a little bit less expensive, but we think that insurance is going to cover pretty much the same as they would for the trivalent and the quadrivalent.
Gotcha. But what is the extra? Well, I guess one of the questions that I've heard already so quickly is, it's not even October yet. Should I get the flu vaccine now? Is it going to last me through the season? What's the answer to that?
That is a great question. The answer is yes. So we have already started seeing positive flus. We actually get positive flu tests throughout the year, but in the past couple of weeks I have had an increase in the number of positive flu tests, and it's right around the corner. The best time to get your flu vaccination is now, because it takes a couple of weeks for the antibodies to build up in our body so that we can protect ourselves against the flu.
Gotcha. Thank you so much, Dr. McCarthy. We'll be with her throughout the morning, and we've opened it up to you on Facebook. What are your questions for Dr. McCarthy? We will ask them live on air a little bit later in the newscast. Stay with us.
Health news now, making sure you're ready for the upcoming flu season. Fox 59's Michael Henrik is now live with what you need to know about the variety of vaccines and which ones are best for you. Looks like you're getting ready to get a flu shot or just showing off your guns, Michael.
This is actually just a fashion statement, Scott. I walk around like this when I'm not on camera, but thankfully, yes, Dr. Michelle McCarthy with Community MedCheck in Noblesville on her birthday has come in early to answer questions. Happy birthday, by the way, and administer the flu shot to me. We opened this up on Facebook here to our viewers, and we have some questions that I've grouped together here. Claudia Weidman and Lisa Sturm both kind of want to know the same things here. They want to know what's the difference between the flu shot and the flu mist. They want to know what's the better vaccine, and if the mist is as effective as the shot. And as you're answering that, please go do your thing. I'm ready.
We'll get ready.
I'm ready.
So yes, the shot is about as equally protective as the flu mist. And there is a difference between the two. The shot is an inactivated or killed virus, and the nasal mist has an attenuated or weakened virus. Neither one can cause the flu. So if you want the mist, you have to make sure, though, that you are healthy, ages 2 through 49. Otherwise, you would want to go with the shot.
And that is what we see here as he takes a close-up here of what you're looking at. You cleaned my arm off here, right?
Yes.
And we are ready to go. Now, one of the questions we got from one of our viewers here, I want to make sure we give the shout out here, Anne-Marie Hartman Adams. See, I'm hardly even feeling it.
Good job.
It doesn't hurt. It's done. It's over with. And Dr. McCarthy can now answer this question. Anne-Marie Hartman Adams wants to know, my husband and I are trying to have a baby. Will the shot be dangerous if I get it in the very early stages of pregnancy? We just have about 15 seconds.
No,
here.
you want to get it in pregnancy. It is so important to protect yourself when you are pregnant. It is worse to have the flu. So definitely she should go ahead and get that flu shot. And if you are living with somebody who is pregnant or around somebody else who does have a weaker immune system, please get the flu shot to protect them, not just yourself.
Great. Thank you so much, Dr. McCarthy. We have one more live interview coming up in an hour. I will not have my farmer's tan on display, but we do want you to get your questions in on our Facebook page. We're live in Noblesville. Michael Henrik, Fox 59 News.
Cute. All right, the main question from us was why he had his jacket. Nice job. All right, the gearing up for the upcoming flu season and staying one step ahead of the nasty bug's arrival in central Indiana. That's what we're all trying to do, right? Michael Henrik live with what you need to know about the variety of vaccines now and which one might be best suited for you. Michael?
Hey, good morning. Yeah, and we've solicited some questions from our Facebook viewers here, and we want to ask Dr. Michelle McCarthy from Community MedCheck in Noblesville a couple more of these questions. First of all, happy birthday again, and thank you for being with us early. I'm going to keep embarrassing you. Bob Weidman from our Facebook page asks, the most common question is probably, can I get the flu from the flu shot, and you hear this every year, I'm sure.
Yes, and I understand why it scares people from getting it, but you cannot get the flu from the flu shot or the mist. I think what happens a lot of times is, it takes 2 weeks for the antibodies to build up in our body after we get vaccinated from the flu. And therefore, if you get your flu shot and then you're exposed to the flu sometime before your antibodies have built up, it may seem like you got it from the flu vaccine, but you didn't.
Gotcha. And is that lag time, the 2-week lag time, the same for the mist and the shot?
It is, and that's why we encourage the community to really think about getting your flu vaccine as soon as the vaccines become available. But it is never too late to get your flu vaccine, because we see flu all the way into April, May.
Gotcha. And you told us earlier that even getting it now, it lasts through the entire season, and that's an important point we want to bring up again. Also, we wanted to touch on briefly about, well, I guess about touching and prevention, spreading this virus. How do we prevent that even as we get the vaccine?
So we're contagious about 1 day before our flu symptoms come on, and probably 5 to 7 days on average after our symptoms start. So the number one best way of preventing the flu is the vaccine. After that, we have to remember the good hand hygiene. Little kids got this down. We need to look at them as a model. No longer are we wanting to cough or sneeze in our hands, because then we touch a surface, the virus is on that surface. We want to cough or sneeze in our elbow, our arm, and look at the little kids again for a model, because they do it perfectly.
Gotcha. Perfect. Dr. Michelle McCarthy, thank you so much for being with us here live at Community MedCheck in Noblesville. We have more of your answers in some of the earlier clips we'll post online at fox59.com. We are live. Michael Henrik, Fox 59 News.